When we got done with school, because you can go out straight out of dental school, start practicing, you can be a dentist. And I think a lot of people do that and are good dentists.
Yeah, fantastic.
You know, depending on what you want to do and what type of procedures you want to do, that can be done. Then there's kind of the far end of the spectrum where you specialize and then you don't do a whole lot of general dentistry, but you do one thing in particular. That's
Very
like,
well,
you know, your surgery residents, your periodontists, endodontists, stuff like that. And then where we kind of fell was in between those two areas. We didn't feel like straight out of school we had a good enough grasp on everything to be incredibly proficient, mostly from a time perspective and also from a volume perspective in terms of what we were seeing, just about how busy people were in general practice. But we also wanted some of those skills that specialists have, but general practitioners do not. So for us, when we looked at residency programs and applying our senior year at dental school, we looked heavily into things like surgery, sedation, implants, kind of all in that regard.
Coming out of dental school prepares you pretty well to kind of do your day in, day out general thing. You know, cavity pops up here or there, that type of thing, you can fix it up. Knowing that, looking at our last year, we were looking into those residencies going, you know, there's a lot of need for some comprehensive work that's out there. And so how do we help these patients in the most effective manner? So looking at those residencies where you can do kind of larger reconstructive type cases with the aid of sedation, high anxiety, things like that. A lot of those patients were falling through the cracks. So we wanted to be able to help out, you know, anyone and everyone we can. We think that dentistry should be available to, you know, anyone. Doesn't matter how anxious we are about anything. So it allows us to handle not only the in and out everyday thing, but those kind of advanced cases that require multidiscipline type things, and just really kind of reconstruct everyone back to just a healthy, happier smile.
Yeah, well, and we talked about that a lot in school in terms of just like barriers to entry.
Yeah.
Because, you know, you see a lot of, I mean, we saw a lot of anxious patients even when we were in school.
Oh, yeah.
And, you know, from the perspective of being able to see those patients at the cost level that they were at there was very difficult, especially from a general dentistry perspective. A lot of the times if a dental office has to hire a service to bring someone in to sedate someone, it can cost several thousands of dollars, and it's mostly based on time. So if you're a sedated patient who already needs, you know, 5,000 to 10,000 worth of dental care, and, you know, that's going to take a dentist 4 hours, and then they have to bring in a third-party IV sedation company to come in and do that, you know, that may be looking at doubling or even tripling the cost of your treatment overall. And that's just for that one appointment. And so that was a big thing too. In addition to that, you know, even if you are that patient, if you go to a general dentist who doesn't do all the procedures that, you know, you may have to go to a specialist to have certain things done. If you need a root canal and your dentist can't do it, then you're looking at breaking up, you know, well, I've got to go here and have this root canal done, and maybe I have to go here and have this implant done, and then I have to have my general dentistry work done at that office. So that's 3 separate appointments that you'd need to be sedated for. And when you start adding all of that up, you know, it just becomes snowballs and becomes astronomical. People look at the cost of, you know, all of that together, and it seems so unfeasible that you see people just not even seeking out help. They kind of,
and that's time of work. That's a lot. In there, it really adds up, you know. Yeah.
And so I think the biggest thing that we wanted to do was, you know, obviously there are still some things that are outside of our scope, and we're, at least, you know, from our residencies, I think we spent a good amount of time ascertaining what those things are. Like, we got very comfortable with where our limit is, and we don't operate outside of the scope of our practice. So unfortunately, there are always times where we do have to send people to specialists and things like that, but we do that when it's necessary. But I would say, you know, probably 80 to 90% of the time, we can do almost everything anyone needs in-house and keep everyone here. And that also makes patients more comfortable when they know their provider and they know that they can get just about anything they need done here, and that we can help them get it done and kind of get back to either a state of oral health or healthier, happier smile.
Yeah.